Hi, I'm Dr. Bill Lyle and I practice obstetrics and gynecology. I'm board certified in obstetrics and gynecology and I'm licensed to practice medicine in both Florida and Alabama. We treat the preborn as patients, and a patient is a person, no matter how small. Today we're going to talk about RU-486. RU-486, also known as the abortion pill, is responsible for about 35 to 40% of all abortions performed here in the United States. That's about 300 to 400,000 abortions each year in the United States are just due to RU-486. Well, what is RU-486? RU-486 is a progesterone blocker. The hormone that is released when a woman becomes pregnant that acts as the conductor for the whole symphony of pregnancy is called progesterone. It sends a signal to the whole body, hey, we're pregnant. Congratulations. Let's support this pregnancy, develop this pregnancy, and grow this new person that is here on the inside. RU-486 very successfully blocks that signal. But it's not effective 100% of the time. The combination of RU-486 and another medication called Cytotec, the success is about 98%. Well, what about that other 2% that survive? Well, there have been studies on this. The Journal of Reproductive Health and Contraception, right here, I'll quote them, the lack of teratogenicity should the pregnancy continue is why RU-486 is often chosen to be used. But also ACOG, the American College of Obstetricians and Gynecologists, says mifepristone, RU-486, is not known to cause birth defects. So if the RU-486 does not work and the continuation of the pregnancy occurs, well, you don't have to worry about there being birth defects to the baby because of the administration of the RU-486. Well, what about reversing the effect of RU-486? We have been very successful nationwide with over 800 documented cases of successfully reversing the effects of RU-486. I'm going to use my wife for the demonstration of how reversal actually occurs. We use a hormone called progesterone. RU-486 blocks progesterone. We just raise the natural level of progesterone. So this is my wife sitting here. This is Leslie. So if Leslie were sitting here and if she were pregnant, there would be a hormone called progesterone which would be released. But we're not going to get pregnant. So the signal I'm going to use to Leslie is something real simple. I'm just going to say, I love you, which puts a little smile on her face because we just communicated. Well, what does RU-486 do? RU-486 to the body is kind of like this set of earmuffs. So if I take this set of earmuffs and I put them on Leslie and she adjusts them, and then I give the same signal and I say, I love you. There's no smile. There's no reaction. Well, what if I turn the volume up? What if I speak louder and I say, I love you? Now we get a smile. It's the same way when we add progesterone. When we add progesterone, it's just increasing the volume. So where she couldn't hear me say, I love you, because of the earmuffs, that's what RU-486 does. Prometrium, the progesterone which we add, just turns up the volume on the progesterone. So all of a sudden the body is thinking, yay, we're pregnant. Then, oh, I thought we were pregnant. It's like, no, it's okay. Yes, we are pregnant. Well, what about the reversal agent? Can that hurt a baby? We use the progesterone, prometrium, in pregnancy every day. I probably have 12 or 15 patients right now that are on prometrium. We use it for patients who've had recurrent miscarriage, where their body just doesn't release and produce enough progesterone. So what do we do to keep a pregnancy going? We give them extra progesterone. We raise that signal. But progesterone also relaxes the uterus. It prevents preterm labor. We use it for our patients with histories of preterm labor. We use it for our patients that have twins or triplets or quadruplets. We give them progesterone. We give it because we know not only does it help support and prolong the pregnancy, but we also know that it doesn't cause birth defects in the baby. So when it comes to trying a reversal, and we've documented over 800 successful reversals through Abortion Pill Reversal Network, When it comes to the medication that starts and causes the abortion, the RU-486, both ACOG and the Journal of Reproductive Health and lots of other articles say we don't have any evidence that it causes birth defects. So that's the RU-486. The reversal agent, the progesterone, the prometrium, we also use that in pregnancy all the time, and we don't have any evidence that it causes birth defects. So when it comes to attempting a reversal, when a patient says, I took that medicine RU-486 immediately, I knew it was a mistake, I shouldn't have done it, something my heart says, this was wrong. It's just like if somebody were to overdose on narcotics, we would automatically give them the reversal agent, which is Narcan. So when a patient comes to us, comes to our ER, contacts us and says, I made a mistake, I'm pregnant, I'm 8 weeks pregnant, I took the medicine RU-486, we have a duty and a responsibility to say, you know what, we're only about 70% successful based on the knowledge that we have in the current studies. But yes, we can offer this to you. So what do we have to lose? Well, it's the medication that reverses doesn't cause a birth defect. The RU-486 doesn't cause a birth defect. There's not it's a red light, yellow light, or green light. This is either red light or green light. We're either going to be successful or we're not going to be successful. So we have nothing to lose but to attempt to do it and to fulfill the requirements and the needs and the request. And that's our duty as a physician, to give risks, benefits, indications, and alternatives to our patient and try them to have them achieve their goals. God bless you. If you have any questions, you can contact me through my website, prolifedoc.org. And remember, a patient is a person, no matter how small.